Past 9 o'clock. Welcome back to the program for this Wednesday. Not only is it Wednesday, it is Wellness Wednesday, Jackie. And every Wednesday we like to introduce you to some new wellness tips and secrets. And this morning, of course, we have Dr. April Oxendale here from Align Right Chiropractic. And we've talked about these special tools that you have, Dr. April. And what are they called again?
They're the Graston tools. It's Graston technique, and it's a soft tissue technique to work with trigger points all over the body. So I've brought a model with me today, and we're going to give a demonstration. I have lots of people that they're kind of familiar with it, but they just don't really understand it. So I thought for the viewers at home that we would actually kind of give it a demonstration today.
Because we see those, I mean, if you want to hold one up, they're those metal pieces, and it's like, you're going to do what with what?
Exactly, because you show the instruments here. It's called the handlebar, because it looks like a handlebar on a bicycle. And this is actually one of the go-to instruments that I use for the shoulders and the upper back and through here.
And now, what is the ailment here that we're trying to treat?
So Mary has trigger points in through her upper trapezius in through here. This muscle.
Okay, in common language, that would be what?
She has knots, muscle knots, all kinds of muscle knots in through here.
You know, Doc, if you needed a model, you could have.
Yeah, any one of us, we could have
volunteered. No, talk us through what you're going to be doing this morning.
Okay, so Mary is actually a patient of mine, and I have examined her before. She's actually under treatment right now for these trigger points. So she has knots in through here. If I push here, and you can kind of see how the skin actually is getting red just from the touch, because the tissues in through here are really active right now. So what we do is I use a massage cream, and I apply it to the tissue, to the surface of her shoulder, upper back area.
Now, is that just like a cold cream type thing?
It is. It's a massage cream, and then I actually add a little bit of stuff called rock sauce, which is kind of like a souped up icy hot, so it gives you an icy hot sensation. And it helps with inflammation into the tissues. So then I use the handlebar, and we kind of scan through the tissues. And I don't know if, I mean, you probably can't see it very well, but when the bar comes over, there's a big bump in through here. Right. So then that tells me that there's a knot in through there that we need to work out. So it's just it can be a little uncomfortable at times, but you just work out through this knot over here, and you can see that her skin is getting nice and red. Part of that is just the friction. Part of it is an increase in circulation, which is what we're looking for.
Now, explain the differences of doing a procedure like this and maybe someone just going in and getting a massage or something like that.
So the massage therapists, they're great people. I love them. I see one on a regular basis. But your thumb's only so small and your elbow's only so small, so they can only get in there different ways. Where the tools here are built on a 45-degree angle. And so it just gets in there at a different angle than what the body can, than what a thumb or an elbow can. And so it gets in there a little bit deeper.
How long would you be working on an area like that?
Usually no more than 5 to 10 minutes. And the skin will actually give you a reaction that tells you when to stop. It'll give you, it's called petechia bruising, which is little red dimples or little red spots. And then that's the body's way of saying, hey, I'm done.
Okay.
So, and then another option for people who think that Graston may be a little bit too invasive is something called cupping that I do in the office. And so it uses cups like this. They've got a one-way valve on them. And you can put them over that same area of tension. And it's literally like a suction cup that you pull the tissue up into the cup. And you let it sit there for 5 to 10 minutes.
And what does that do?
So what this is doing is it's pulling all that blood up to the surface, so you're getting fresh circulation into the tissues underneath it. So it's kind of help resetting that muscle. It gets rid of all the toxins and all the built-up stuff that's inside of that muscle. It'll turn a deep purple color, and then when you take the cup back off, it's usually a red color. It will tend to bruise just because it is a suction cup.
So what parts of the body can you work on with these tools?
Anything and everything. I see a lot with the shoulders. Carpal tunnel, lots of times, is in through the forearm and the carpal tunnel itself. Plantar fasciitis, the bottom of the foot. People that have low back injuries, we can do Graston through the low back. Cupping is fantastic on the low back. All my patients get a really good sense of relief through the low back with the cups. You can do Graston on IT bands. You can do it on quads, hamstrings, calves, pretty much anything and everything.
I want to back up for a second here and talk about plantar fasciitis. A lot of people suffer from this. I mean, we're talking millions of people suffer from this.
Yes.
But if you ever had this, you realize if any type of pressure is applied to that area, you'll jump out of your skin.
Yes, it's usually
How in the world will you use these tools to help get rid of that pain?
Gently. So you start off with a nice gentle pressure. The patient is laying face down on a table first, so that kind of takes some of the pressure off because they're not in a sitting position, so that everything is relaxed through the legs. And you start with the one that I actually use is this one through the foot, and you actually start in the middle of the foot, the arch of the foot, because that's usually the least tender spot when you're working on it. So you start in the arch of the foot and just work your way towards the heel and towards the toes.
And how many sessions will that usually take?
Depending on how bad the plantar fasciitis is, I tell people to give me 6, and it's twice a week for 3 weeks.
Okay.
So who's a good candidate for all of these techniques? Who's sitting at home going, well, you know, that would be good for what I have?
As far as like what they are doing for work, or?
Well, just what kind of pain they're experiencing and using these techniques, who could you best help?
People who suffer from headaches almost on a daily basis. Lots of times it's because of the tension and through these upper shoulders. If you're at a computer all day and you are noticing your hands are falling asleep or your arms are just feeling heavy, runners and bicyclists that have leg issues, if they're just feeling really tight and cramped up, they can often have knots in their muscles that they need to have worked out. With the plantar fasciitis, anybody the first thing in the morning when they get up and they fall to their knees because the first 3 steps kill them, it's great for that. It's not real well suitable for diabetics because they take longer to heal. And so anybody that's on blood thinners also, it wouldn't be suited for because they also take longer to heal. And you are causing tissue damage on a microscopic level.
Okay.
Wow. Well, thank you for giving us a more in-depth view of how the Grastons work.
So we understand what's going on, and the cupping is
and the cupping as well. Too. It's interesting. Just you definitely can see the skin
see it change in
color
a little bit. Yeah, look at that.
So there's her circle.
Yeah, she almost has a
temporary. Now, doctor, next time you do something like this, we'll be happy to volunteer.
I'll keep you in mind.
You don't have to make one of your patients get up early.
All right, tell everybody where they can go visit you in case they want to come over and have you take a look at them.
Align Right Chiropractic. We're on 82nd and Hickman in Clive. You can visit my website at myalignright.com or check us out on Facebook. And if anybody has any questions, submit them to me and I'll answer them.
All right, wonderful. Great job. Thank you so much.
Thank you.
We'll be right back. It's 9:20. You're watching Great Day.